Hi, my name is Lianne May. I'm a student at Colorado Christian University, and this is my presentation on healthcare policy and law. In healthcare, the importance of policymaking and laws are to define the appropriate relationships between the care providers and the care receivers, patients, to create, protect, and restrict individual rights, set standards of quality, and regulate cost. But what is healthcare law, and what does it do? Healthcare laws are comprised of statutes which are written and enacted by legislatures at both the state and federal level that have been written and designated for a specific purpose. Healthcare regulations are often broadly written by elected officials, and then the specificity of terms are left to non-elected officials and administrators at both the state and federal level. Among other things, healthcare laws aim to advance policy goals in healthcare, protect patient rights, control the training and practice standards of health workers, regulate medical facilities, and regulate the collection and use of health information. This is especially prevalent given the ACA's mandates on electronic medical record and health information technology adoption and utilization within healthcare. The Affordable Care Act, HIPAA, Medicare, Medicaid, Individual Mandate, COBRA, and CHIP are all examples of healthcare laws. COBRA is intended to prevent a gap in health insurance during periods of unemployment for up to 18 months, and the CHIP program provides health insurance and health care to children of low-income families up to 26 years of age. The difference between healthcare policy and healthcare law is healthcare policy aims to influence or promote change through incentives, whereas a law seeks to establish boundaries by means of legislation defining what you can and can't do, while additionally setting forth consequences for infractions. Some examples of healthcare policies are the culture of health as outlined by the Robert Johnson Wood Foundation, who believes that health is comprised of both physical and mental states of well-being. This is based on the science that shows the impact that mental health has an impact on physical health, as well as the desire to normalize and be inclusive of mental health care. Preventative medicine is another healthcare policy. It's not a law, but certain mandates of the ACA, such as the Medical Necessity Clause, which is defined as the right care for the right patient at the right time, seek to incentivize preventative care. This is a move away from the practice of curative medicine that has been at the core of U.S. medicine for the last century. Another is prescription drug prices, disease prevention through public health information and education, as well as vaccines, even dental and vision insurance. They are not required by law, but they seek to influence people to take preventative measures with their health. For many, the cost of insurance that covers preventative care costs less than treating a problem. So despite the benefits of healthcare policies and laws, there are still many problems. The quote to the left states that healthcare law has been outpaced by medical practice and economic needs. The ACA, one of the largest healthcare reforms since Medicare and Medicaid, seeks to address just that. However, one of the biggest problems with law in healthcare is that you cannot legislate personal responsibility. A patient is free to do whatever they wish, and no one can force a patient's compliance with doctor's orders. Many argue that before we didn't have enough laws and policy to regulate medical providers, and now the pendulum has swung too far in the opposite direction. And they're right. The IOM's 1999 report to Error is Human is clear indication that there was not enough in place to protect patients. But now many are arguing that the regulations have been taken too far and that it's actually restrictive rather than helpful. And also, because of the broad nature of healthcare legislative writing, it is often open to interpretation. So oftentimes there is opposition between state and federal laws. An example would be marijuana. It's illegal on a federal level, but many states have it legalized, such as California and Colorado. Additionally, the constant flux and change in healthcare law and policy also means jobs and responsibilities are constantly changing or being reassigned. This process has led to the creation of licensed vocational nurses, physician's assistants, hospitalists, and medical assistants in an effort to delegate responsibilities. And one of the other things that I think is really important to recognize is that with an opposition in state and federal laws, even state-to-state laws for healthcare and expectations of quality, those different interpretations directly affect the delivery of care and the expectation of the kind of care one should expect to receive. So some examples of those state-to-state policies or state-to-federal oppositional policies are the corporate practice of medicine, which is meant to prevent medical providers from being unduly pressured or influenced by medical device companies or pharmaceuticals. But in different states, there are different statutes and there are exclusions to that policy. There's also the certificate of need, which is meant to prevent the overutilization of medical services and supplies, which is most predominant in the nursing home sector of healthcare, where there's a lot of hospital beds and medical equipment that's being utilized. There's also licensing laws for medical professionals that vary from state to state. So while you might be certified and licensed to practice in one state, you might not be able to in another state by their laws. There's, again, the state legalization of marijuana. There are a couple of different other laws that at a federal level, they're either legal or illegal, and then at the state level, they're exactly the opposite. You also have state-to-state insurance regulations, which vary wildly. There's also the option, of course, of purchasing out-of-state insurance, and what complexity does that add to providing care when the insurance originates in a state where the patient does not reside and where they are receiving care. And additionally, and most importantly, the ACA seeks to standardize care through policies and laws, but unfortunately, it still leaves certain groups extremely vulnerable. There's a quote that says, healthcare should be really prioritized at a local level rather than a national, because the communities that are served by healthcare providers vary wildly. And different people need different types of care at different times of their life in different ways. Simply stamping a one-size approach fits all to healthcare is not actually going to help a whole lot of people. And then lastly, being that we're at a Christian college and we should be looking at our education and what we're learning through a biblical lens, I wanted to bring a biblical integration into this presentation. Healthcare workers will often refer to the listed verses in the first bullet point and state that they feel the Bible calls us to care. We are called by God to care for the weak and oppressed and to adhere to God's law. This clearly states that there is law present in the Bible, and it is an integral proponent of the Bible's teachings and is mentioned at least 590 times in the NIV version alone. And Romans 13 specifically states that regarding law, every person should be subject to governing authorities, that there is no authority except God, and that anyone God has placed in a position of authority is there by his power, for better or for worse. That includes Trump. And then this quote basically states that God built logic and law into the universe. It is innate, it is part of his character, and because he is the creator, he expects us to follow the laws. And laws are not meant to be restrictive. They're not meant to take the fun out of life. If anything, they're meant to enhance the joy and protect us and keep us safe. And then lastly, the link at the bottom of the page is to an article that is written about the intersection of medical science and religion. Can they safely coexist? I say they are, but many people have different lines in the sand, different places of where they draw that line in the sand. And this article examines those arguments and does a good job of arguing for medicine and religion having a place together in the world. So I'd encourage everybody to take a look at it if they have some time and make up their own mind. So thank you for listening to my presentation. These are my references. There are probably too many. I appreciate your time. Thank you.